dreams really having dreams, but sometimes not figuring out how to get there. I went to Harbin High, go Bears, and yeah. And so I remember sitting in my senior year and really having that spring blues, as I call them, for undocumented students, really not knowing how you're going to be able to go to school. And so I'm really thankful for plays like this because I really think that they feed our soul and allow us to move forward with this fight. So I'm not sure when the Dreamer movement began. I remember in 2006 becoming very active. There was a law way before, you guys would probably remember, HR 4437, which really threatened our undocumented families. They said that even if you gave an undocumented person a ride, it would make you a felon. And that's simply ridiculous, right? Because we all know undocumented people if you're not undocumented yourself. And so that would make everyone in this country a criminal. And so from there, I really saw the spark began in our movement. It wasn't just, they weren't even called Dreamers then, right? It was just students who walked out of school because they knew that there was something very wrong going on. They might have not been able to tell the media what it was, but they knew that their community was being attacked and they knew it in their hearts. And so I was in college at that time. I had just started at Bakersfield College, and the students started walking out of high school. So we started rallying them, taking them to CSUB. I was an unlicensed driver transporting about 10 students at a time, getting them there so that we could really talk to them about what the law meant. And what impact it would have on our communities. And we began organizing, and that was in the Central Valley. Every place in the United States really started organizing around this, and then we had those massive marches that happened in 2006. And I think every year after that, we just keep getting stronger. Sometimes we don't have the marches, sometimes it might seem like things are a little bit slower, but we're organizing one person at a time to make sure that we're able to get that peace of mind that we need in our communities. And I think plays like this, if someone like Donald Trump were to see it, then instead of thinking, well, I won't say what they think with, but instead of being the hateful person that he is, he might start thinking through his heart instead.
Big elephants in the room, which I hope we'll get to at some time in the panel. But there's Donald Trump, there's a Pulse visit, and his address to Congress where he, kind of highlighted immigration. And then there's John Boehner's resignation. 3 big elephants in the room that just occurred. So Lorena, can you tell us, we've been involved in the Dreamer movement here locally. Can you tell us what it looks like in Kern County?
Yeah, so currently I'm 25, so when I imagine the word dreamer, I imagine a little bit younger, just as a disclaimer. I guess the undocumented youth movement has really changed over the years, at least from my experience. When I was at Cal State Bakersfield, I was lucky enough to meet Paola, and she's the one that got me involved in a lot of this. It was a process, like many undocumented youth. I remember she was tabling outside for the club fair, and she had a little thing that we would need. And I just approached because I was just like, oh, I'm wondering what this is. And she's like, do you want to call Governor Jerry Brown to support the DREAM Act? And I'm like, I'll just take the paper and call another time. But I think that the movement has really changed over the years. I'm really glad that it has a lot of new faces have come on board. I know people move on, they start families, they start careers, but I'm really glad that the youth has been able to kind of just continue to speak up. And so I know it has shifted a lot from immigration reform to deportations, but overall I'm really glad that the youth has managed to stay with their community and continue to speak up for a lot of the families.
Thank you. Donald Trump is somebody who really needs to be countered. He is very anti-Latino, anti-immigrant, in my opinion. Pope's visit was very refreshing, you know, and and I don't know if you guys heard, but the Pope addressed Congress, and he said that immigrants were, all of us were immigrants at one point, and we all immigrated in order to seek a better life, and we all deserve an opportunity. So on that note, I think Wayne will be able to address some of those points. But Wayne, can you tell us what the Dreamer movement looks like around the country? I know you traveled extensively, so can you chime in on that?
Well, first of all, they've taken away all your throwing items and made some references in the play with the lawyers, and I want to make sure I'm safe up here.
He's a good lawyer.
So, I want to correct something that happened early on in the play. There was a reference, an innocent reference to DACA and Dreamer. I want to draw a big wall of separation between the two and draw the distinction. They are not the same. There was another reference early in the play that said something about the candy and the sugar high. DACA is your sugar. DACA is a very temporary sugar high because it has very little, if anything, to do with the DREAM Act. The DREAM Act is a permanent solution to give young people an opportunity to have a real and joyful and happy and prosperous life in the United States. That is not DACA. It's a very temporary sugar fix by giving you a driver's license, a social security number, employment opportunities. But you mentioned this one presidential candidate. I shudder to think what would happen if the mentality of certain elements in politics today were to take charge and decide, you know what? Not sure we want all of those DACA people to have opportunities. It could happen. Now, having said that, I do not in any way want to discourage anyone from applying for DACA. I think it is a tremendous program that is very necessary in light of the current political climate. We need the DACA kids to come forward, to apply, to capture the opportunity, because as the play so excellently demonstrated, there is tremendous benefit and strength in numbers. But let's get involved politically. Sí, so puede.
Kind of give us stress the importance here of getting out the vote. I know Latinos. I mean, we're the lowest voter turnout group among all the different groups. We need to get out there and vote. Jose, can you kind of give us the importance of that, and especially as it relates to the immigration issues?
Yes. As regards to getting involved and voting. So in the last election, the voter turnout was very, very, very low. And I came across this photo on Facebook, and it was very telling. It said, I had two big crowds of people, and a small crowd said, I'm the one that voted, and the bigger crowd with a lot more people said, I'm the one that didn't vote because my vote doesn't matter. And just the visual representation of that photo says, if you vote, it does matter. Right now, there is less than 40, or in the last election, less than 40% voter turnout. That means the majority of the people eligible to vote did not vote. Now, why does voting make a difference? Voting makes a difference because these policies that are put in place, these elected officials that are making decisions that directly affect every one of you and everybody in this country, they get elected based on the people that vote. Right, so the main reason why immigration reform stalled in 2013, the president came out for it. There was 8 Democrat and Republican senators in the Senate that crafted a bill. It passed the Senate, and over in the House, there was a majority of the representatives in the House of Representatives that were supporting it. But because decisions of a few elected officials who got elected from a constituency that isn't involved or doesn't necessarily care that much about immigration reform, that's why it hasn't moved forward. And that's just one example of the importance of getting involved. Now, the DREAM Act has been talked about. In California, Governor Jerry Brown and the legislature passed their version of the DREAM Act, which gave undocumented residents ability to go to college with in-state tuition. And
Financially, we already have a state.
okay, with some financial aid. The reason why they did it in California is because it failed at the national level. In the Senate, again, four or five key senators didn't vote for it. Why? Because they did have some Hispanics, they did have some people that were, that cared about immigration reform in their states, but they didn't show up to vote. They didn't get active, right? So voting isn't necessarily the only way to get involved. Getting involved is you call your elected officials. How many of you guys know who your congressperson is? Raise your hand. How many of you guys know who your district supervisor is? Raise your hand. How many of you guys know who your city council person is? Raise your hand. How about your governor? Right, so this shows that the importance and the need of getting involved, right? And so, and in terms of the political climate regarding immigration reform and regarding the hashtag Health for All push, if you get more involved, if you talk to your elected representatives, if you campaign for the ones that you have the same ideas for, and if you show up to council meetings, board meetings, that's how you move these ideas forward. Because trust me, they listen to the ones that show up. If you're not at the table, you're on the menu. And so if you don't vote, then you're on the menu.
Thank you, sir. Are you up for election 2016? So you already high students are going to be eligible to vote by then. So well, they didn't want to make a picture. He didn't want to seek your support, but he is going to be up for election, and so that's a good opportunity for you to vote for the first time and vote for your city councilman. We'll take a roll up.
Can I say something?
Sure, go ahead.
I just want to make sure that there's no disconnect, because here we're talking about undocumented immigrants who we don't have the right to vote, right? And so it might wash over your head because we're talking about voting if you happen to be undocumented, and you're like, well, okay, you're saying that I should vote, but I can't vote, so I'm just going to stop listening to this conversation. And not many of you raised your hands, and that's okay, because when I was in high school, I don't think I knew a lot of that information either. I didn't even know that I could have an impact on changing the laws that were affecting my life at that point. Now I do, because I've seen my life change substantially with deferred action, because even though the play said that Obama gave us deferred action, it wasn't President Obama. It was actually students like Lorena, like myself, who shut down his offices while he was campaigning, and really got into the forefront of the media and shared our stories that pushed him to do that. If not, he was going to lose the election. So I want to point that out. The other thing is that if you can't vote, it doesn't mean you can't have an impact. You can have the biggest impact, because I can't vote myself, but I can register 100 people to vote, share my story with them, and have them vote against Trump, against whichever candidate is going to hurt immigrants, right? So I could do that as an individual, and you could do that as an individual. So tonight, or today on your smartphones, you can Google who your governor is and who your supervisor and your city councilman is. That's easy to fix. What's going to take more work is finding the dedication to do the work, to start doing that voter registration, to make sure that we get what we need for our communities. After we got deferred action, I got on a plane. I was still undocumented. They had just passed deferred action, but I got on a plane to Florida to go work on a presidential election, just to make sure that we could safeguard DACA. And I'm not saying that everyone needs to do that, but I just want to point out that each and every one of you that's sitting out there, whether you're documented or undocumented, you have the opportunity to change your life and the life of those around you. So I just want everyone to know that.
Thank you, Paul, for sharing. Yes, I definitely want to stress the fact that, comprehensive immigration reporting and all these other piecemeal issues that we're working on, we need to work together. Those who vote need to get out to vote, and those who are undocumented, you can become active and you can make an impact, just like Paula says. Lorena, you want to, Paula mentioned that, undocumented youth can have an impact. And why don't you kind of talk a little bit about, some of the ways which you've been involved in the movement yourself over the years?
Myself? Okay. So like I stated earlier, as an undocumented youth, it was a process for me to even approach anybody that talked about immigration, because the way that I grew up as an undocumented immigrant and an undocumented, actually mixed status family, it meant that my parents told me, you know, don't talk about your immigration status, just go to school, do everything right, and everything will turn out okay. And so that's what I did, but once again, you know, high school, can't go to UC San Diego, can't go to the colleges that I wanted to because I didn't have that social security number to my name. And honestly, it was a long process for me. The way that I've seen is some undocumented youth, right from the beginning, they're like, yeah, I'm undocumented, I'm gonna fight for rights, I'm gonna do this, and it took me a while. I wanna say I started getting involved like when I was 21, 22, I don't remember honestly. But it was because I had that one person that said, I'm also undocumented and this is what you can do. And so my process has been a little bit longer, but definitely it's because I had that one person or that group that said, you know, this is how you can get involved, and you don't have to tell your story in the entire world that you're undocumented, but help us table, help us flyer, help us do these little things. And so I think my process was a long one, but I think I'm able to sit in front of you and say I'm undocumented because I started just by doing something little. So, yeah.
Thank you, Lorena. Jose mentioned a little bit about the political landscape of what happened in 2013. In 2013, we very nearly had comprehensive immigration reform that would have provided a pathway to citizenship for our undocumented youth and other undocumented immigrants. Unfortunately, that didn't pass because the House didn't want to take vote. The speaker at the time, John Boehner, who just resigned today, didn't allow it to come up for a vote. Unfortunately, and it probably would have passed if he would have allowed it to come up for a vote, but he has that power, and he has that outside influence as Speaker of the House. So, Win, why don't you give us your take on what happened then in 2013?
Well, let's back up on a little bit of history. In 2007, then President George W. Bush had a real passion. He was working with his brother Jeb Bush to make comprehensive reform happen. And there was one senator who blocked it on behalf of big labor. That senator was Barack Obama, became president. Now, in 2013, there was a tremendous push again to try to bring about comprehensive reform. We had a terrific coalition. I worked directly with some of the members of what we call the Gang of Eight in the United States Senate. And we were able to get some pretty good things in the bill, including treating spouses and children of lawful permanent residents the same as immediate relatives. This is a commonsensical way to just keep families together, and it should have been a part of our law all along. There were some real poison pills in the bill. Some of the investment immigration side was pretty tough to swallow, but overall, it was an equal opportunity offending bill, which made it likely to pass. But when it came down to getting the votes in the House, we've always had somewhere between 63 and 67 votes in the House to pass Senate Bill 744. It passed the Senate with a pretty large margin. 2/3 of the Senate voted for Senate Bill 744. It was very unfortunate that the right-leaning members of the House of Representatives prevailed on John Boehner to institute what they call this Hastert rule, that unless there was a majority of Republicans to vote for the bill, he would not bring it up for a vote. At any given time for that 2 years that it was pending, since 2013, or a year and a half or so, it would have passed. A lot of the issues would have been resolved. The Republicans are in deep trouble now because of that tragic mistake that they made in not bringing it up for a vote. So where we go from here, I'm not entirely clear, but I think that, I really want to believe very much, and I think this is possible, that there's going to be a shift in the presidential campaigns on the Republican side very soon. We're going to be rid of the front runner whose name I'd rather not mention, or he might call me just an okay lawyer, as he did Dr. Carson. But I think that very likely we're going to start winnowing down to a group of 3 presidential candidates, and that would be Jeb Bush, John Kasich, and Marco Rubio. Of those, I actually worked with Marco Rubio's staff in parts of Senate Bill 744. I think that could be a very reasonable development for us. On the Democrat side, it is really an open question here whether Joe Biden is going to come in and not go in, whether Hillary Clinton will survive the current discussions around her, or whether they'll nominate Bernie Sanders. I think that's unlikely, but I don't know. You want to talk about that, or is that what you're looking for?
We'll kind of, we'll let Jose answer that. Jose, are we going to get comprehensive immigration reform and when? And if you want to, address some of Lynn's remarks, it's at your discretion.
Well, that's a tough question, but I'll try my best.
2017 at the earliest.
I do think that in 2017 is the earliest that it can happen. We've seen, going back to 2014's election cycle, we're already in a presidential election cycle, right? And so in 2014, President Obama was contemplating whether to expand DACA through the DACA program. And he waited after the election, right? Because he knew it was very difficult if he acted. And we knew immigration reform was dead at the beginning of 2014 because of an election cycle. So I do think it's going to have to wait until 2017. And I can tell you what, if people who are passionate about comprehensive immigration reform, they're passionate about common sense policies to not tear families apart, to expand opportunity for everybody, and to tear down the injustice of a broken immigration system, if they go out and vote, then I do think it can happen. But only if they go out to vote. And so it's very tough right now to speculate on the, who's going to be nominated from either party and their stances on immigration reform. We do know that there's some on the right side or on the right wing that are very, very anti-immigrant and that say very hurtful things. And I don't think that they're going to be nominated. And so, and we've seen all the outrage and all the opposition has risen up from that, all the actions that people like Donald Trump have, or the actions taken against Donald Trump by, taking down his apprentice show and doing other things in terms of Miss Universe, right? So that just shows that we can act in numbers, that we are stronger when we are united. Right? There's a saying, old saying from the UFW, un pueblo unido jamás será vencido, right? So a community united shall never be divided, right? And shall never give up and will always succeed, right? So when we work together, we work hand in hand, when we vote, when we support common sense policies and candidates that stand up and maybe, like Senator Rubio did on the Republican side, be open to comprehensive immigration reform, and on the Democratic side, those who are open to common sense ideas that may be challenging the status quo of their party, we have to back them up, right? Because, as elected officials, you may know where's the right way to go, right? But if you don't have any community support and you can't rally your colleagues, then it's not going to happen. One thing I've learned as an elected official, it was early on, was it's not always enough to be right. Right, so those of you guys that are in high school right now, I don't know if you guys have taken government yet, but you guys have maybe taken some history classes. I grew up with this, view of government that it's representative, it's democracy, it's deliberative, it's always right, then you get to college, you take poli sci, and then I got elected and I got involved in politics, and you learn very early on, it's not always enough to be right. So even though immigration reform is the right path, giving people a pathway to citizenship is the right thing to do, we've already seen that's not enough. And so until we rise up, until we demand it from our leaders, that's when it will happen.
Thank you, Jose. I am optimistic that we'll get comprehensive immigration reform. It's only a matter of time. We're not going to get this this election cycle, unfortunately, but we need to work together and keep pressure on, on Washington, on politicians, also our local folks. We need to kind of really, put their feet to the fire together. We're gonna change course here a little bit. Building Healthy Communities, South Kern is a zone that the California Endowment has selected to bring about systemic change in health, education, and environment. And what this play, this panel is meant to do is kind of, to carry on that campaign. It's called the Health for All campaign. You can look it up on social media. It's hashtag Health for All. Just to provide a little bit of context, the Affordable Care Act was passed in 2010, and that kind of set us on a path towards near universal coverage. And it did so by means of requiring people to get health insurance, by expanding Medicaid. Unfortunately, the undocumented population was not included in the Affordable Care Act, and so they are being left behind. I'm going to give you a statistic here. In South Kern, which is comprised of Arden, Lamont, Greenfield, Weepatch, 81% of the native-born population has health insurance, but only 49% of the undocumented population has health insurance. And this causes problems for families, for the communities. And this is one of the reasons why the Building Healthy Communities is launching this Health for All campaign. Can you tell us what Health for All is? Why is it important, and why should we be paying attention to that?
Yeah, so the play touched upon a lot of issues around what it means to be an immigrant, undocumented immigrant in the United States, here in California. One of the things that Health for All addresses, another piece of that, is the fact that when you're undocumented, you don't have access to health care, right? And so, for an example, if your mother or a mother that's undocumented, even though she has been working in the fields for over 10, 20 years, she doesn't have health care and she's still undocumented. Say, she has some type of lump in her breast. Where does she go to get that type of one? Where does she go to ask those questions? Where does she go to get that type of treatment? Currently in Kern County and in some parts of California, that undocumented mother cannot, will have to pay out of pocket basically. And it's not $5, it's not $10, it's not even $100. It can be a very costly type of treatment or prevention that a lot of our families can't afford. And growing up here in the Central Valley in Bakersfield and Kern County, we know that a lot of our communities work in the fields. And so, for example, $1,000, $2,000, $3,000, that's a good chunk of money for our families. So the Health for All campaign here on the local level aims to kind of just change that structure. It aims to tackle the question of what does it look like for our county to invest in the healthcare of all of our residents, including the undocumented. And I don't want to take up too much time on this. We have information in the back. Actually, we have a table that you can get more information. So feel free to stop by, get more information about that initiative, or even if you're just interested about how to get involved if you're undocumented, if you're an immigrant, or if you just have any questions, we'll have information in the back.
Thank you. And Paula, can you expand a little bit on and maybe talk about some of the challenges that undocumented individuals face as a result of not having health care?
I'm not going to get into too much detail because this is very personal, and I've already cried enough while I was watching the play, and I don't want to get more boogers on the window over here. So my mom got really sick about 5 years ago, and we have a local provider. It's a clinic, but unfortunately that clinic just doesn't have the capacity that it needs in order to really give people the type of service that they need, which is looking at a patient as a whole, right? They'll treat one symptom at a time. So her symptoms were a sore throat, pain in her leg, pain in her stomach. Well, they were looking at each thing individually, and of course they couldn't come up with a diagnosis. And so she just became worse and worse. Now, my mom is a super healthy person before this. She eats healthy, she does yoga every day, she runs, she used to run every day. And so we just couldn't figure out what was wrong for someone who's so healthy. And her health just kept declining to the point where she wasn't even able to get out of the couch or the bed. And so at that time, I was a student at CSU Bakersfield, and so it was before we had, undocumented students had financial aid, so I actually had a paid internship, a paid fellowship, and a part-time job to try to get to school. And so I wanted to take her to the doctor, but I knew that I just couldn't, right? Because I only made $12,500 a year, which I paid the IRS, by the way, because undocumented immigrants can do that. And so I just became very frustrated. Thankfully, because of deferred action, because I was able to get my driver's license, my social security number, and get a job, I can now help pay for her healthcare costs. She now has a diagnosis. She was diagnosed 2 years ago. But it's still an extremely expensive, thing that we have to cope with as a family, which I'm thankful to do it. It's my mom. I'll do anything for my mom because she raised me well. I love her. But it's not something that families should have to pick between having the essentials in life and having health insurance. So I want to move away from this just a little bit and say that Health for All is one more way in which we can have a win as an undocumented community, as an immigrant community. Many of you guys know that we got AB 60, got driver's license this year, right, where people are able to now drive with a license. My dad used to have his license, and it was taken away, and Jerry Brown was able to sign that bill again. And so we have had a lot of wins in California. So even though no one here can really answer where immigration reform or when it's going to happen. It's going to happen, but we don't know when. Even though we can't answer that, we can say that we can continue making the changes at the state and at the county level. Because we've got driver's license, we got in-state tuition, we have financial aid for undocumented immigrants, we have a whole host of other bills that are really making the lives of immigrants better. And if we continue to just have those victories, it's a ripple effect that will end up in Washington. Because California is an important state. There's no denying that. So Health for All is one more way in which, one, we can get relief for our families because they deserve to have access to healthcare, because every human being deserves access to healthcare. And number two is we can send that ripple effect to Washington to make sure we do get the opportunity to get a pathway to citizenship so that we can all vote and continue making that difference.
Thank you, Paul. This is going to be a final question. It's for Jose. Jose, you're a city councilman of Arvin, and you represent a large undocumented population. So you see these effects firsthand. But as Arvin city councilman, are there any policy options at your disposal to deal with the gap in insurance? Two-part question. That's the first question. Second question: what would you like to see the county do in regards to closing that gap in insurance coverage?
Yes, well, as a city, we're very limited in terms of what we can do to provide healthcare. That's more of a county issue, and I'll get to that in a second. But what we've done is February 2013, as this immigration reform discussion started happening, we passed a resolution unanimously urging our representative, David Valadao, the House Speaker, the Senate President, our Majority Leader, and President Obama to pass comprehensive immigration reform. Right, so that's what we did in the past, and that's something that as a city we can have a resolution asking the county to support a county-wide healthcare program regardless of immigration status or the hashtag Health for All. Right, so that's something that we can do, but again, it's only words on paper, right? But it's symbolic, and it can start something like Paola said, a ripple effect. Maybe they can start listening. Hey, these 5 leaders that represent an entire city want to see this happen. It's not just a few people, it's this entire city. So that's something that the city of Arvin can start doing. That's something that every city in this county can do to urge the county to begin a pilot program. And that's how I'm going to answer the second question. I think that we need to start first with a pilot program, start out small and then expand it, because if you're going to tell the Board of Supervisors, let's divert some money that's being spent here to cover healthcare coverage for the undocumented or for everybody regardless of immigration and cover everybody, the entire cost, then we most likely won't get any results from that, right? So government policies or progress is sometimes incremental, and these wins are sometimes small, but they lead to bigger wins, right? And so because the county has a budget, they have to pay for the sheriff, the roads, the parks, right? So then, if we want to provide health care for undocumented, which I believe we absolutely have to, their question is going to be, where are we going to get the money from? Well, first of all, this will help save money in the long term, because when you have preventative care, when people go to the doctor regularly, when they, whenever they have an issue, they go to the doctor and they can fix it before it becomes an expensive or chronic disease, then it saves money. Right, but again, contacting our board of supervisors members. If you're in Oregon in the Monte Greenfield, that's Supervisor Leticia Perez. The chairman of the board of supervisors is David Couch. Right, so there are only 5 of them, and for a majority, we only need 3. Right, so just 3 members, but again, they represent big portions of the county. So asking them to start out small. I think there's 66,000 undocumented residents in the county, and like you said, 51% of them are without health care coverage. And so just maybe start out with a certain percentage of those numbers, see how it works, improve the system, and eventually expand the program. It's been done. It's been done in Fresno. It's been done in Sacramento. It was just recently done by Contra Costa County and Monterey County. And so let's lead the way. I think that's something that we can tell our leaders of the county is let's lead the way.
Thank you, Jose. Is Emily? Emily has an announcement here, and while she's on her way over here to get the mic, let's give a hand to our panel. You did a very good job.
Just a couple things. First of all, I apologize for all the lawyer stuff. Unfortunately, those came directly from interviews with undocumented kids. We didn't make anything up. But you can see you can be a great lawyer and make social change, so don't get the wrong impression. The second thing I want to say is that if you like the show, actually this was a shorter